Welcome to Last Minute Lecture. This free chapter overview is designed to help students review and understand key concepts. These summaries supplement, not replace, the original textbook and may not be redistributed or resold. For complete coverage, always consult the official text.
You know, when you first open a textbook on human anatomy, there's this incredibly comforting illusion of uniformity.
Oh, yeah? For sure.
Like, you look at a diagram of the heart or the lungs, the bones, and it's presented as this universal human blueprint.
Right. Very neat and tidy.
Exactly. We all have 206 bones. You know, we all have a 4-chambered heart. It's clean. It's predictable. It makes you feel like if you understand the diagram, well, you just understand every human being on Earth.
Yeah, it implies that if you've seen one human body, you've essentially seen them all. Like, the plumbing is the same, the wiring is the same.
Right. But then you step into the world of neuropsychology, and suddenly that universal blueprint starts to look a lot more like a very rough, heavily edited draft.
Very heavily edited.
Yeah. We all know we aren't identical on the outside, obviously, but neuropsychology asks how and why our brains actually differ on the inside. Because it turns out the universal blueprint of the brain is just a complete myth.
It really is.
Welcome to the deep dive. Today, we're acting as your personal tutors on behalf of the Last Minute Lecture team.
That's right.
Our mission is to give you a shortcut to mastering exactly how cerebral organization differs from person to person, because we're diving into Chapter 14 of Introduction to Neuropsychology, 2nd edition.
And we are sticking strictly to the text today. No outside noise.
Exactly. Okay, let's unpack this. We're going to look closely at the two most scrutinized individual characteristics out there when it comes to the brain. Gender and handedness.
And as we set the analytical stage here, we're going to explore foundational brain structures, functional organization, and the clinical evidence that reveals how our brains are actually operating.
Yeah, the real hard data.
Right. But I want you, the listener, to keep a highly critical eye open as we go through this. We need to constantly ask how much of what we culturally assume about the brain is actually supported by data.
Because, spoiler alert, right, a lot of our assumptions are completely backwards.
Absolutely backwards.
So let's start with the most culturally debated difference of all, which is gender.
Right.
For a long, long time, society has harbored these historical psychological stereotypes. The classic trope you always hear is that males naturally excel at spatial and mechanical skills.
Like mentally rotating a 3D object or navigating.
Exactly, yeah. And then females naturally excel at verbal skills, like language processing and communication.
Right, that's the classic divide.
So the big scientific question is whether that cultural dichotomy actually maps onto the physical anatomy of the brain. Like, does the brain actually code for these stereotypes?
Well, it's a question that researchers have desperately wanted to answer for decades, often just to explain it with the huge variability they see when they, put people into experimental tasks.
Right, they want a clean explanation.
Exactly. So back in the early 1970s, there was this very influential model by Buffrey and Gray, and they tried to explain this geometrically.
Geometrically? How so?
Yeah, so Buffrey and Gray suggested that the male brain was actually less lateralized than the female brain.
Wait, meaning what exactly? What does less lateralized look like in this context?
So lateralization just means that a specific function is handled primarily by one side of the brain, one hemisphere rather than both.
Okay, that makes sense.
So this old model proposed that in men, language functions were represented bilaterally, like spread out across both the left and right hemispheres.
Oh, I see.
And the theory was that because language was taking up so much real estate on both sides, it supposedly crowded out verbal skills.
Leading to a verbal deficit.
Right. But then it somehow boosted spatial abilities in whatever space was left over.
I mean, that feels like we're trying to read a complex software code by just looking at the color of the computer monitor. It just seems entirely too convenient.
It is extremely convenient.
So Buffrey and Gray were basically saying males are worse at verbal tasks because their language is smeared across the whole brain, leaving room for spatial dominance.
That was the idea, yes. But I need to be incredibly clear right now for anyone trying to learn this material.
Yeah.
That model is unanimously rejected by current research.
Oh, totally thrown out.
Completely. It is essentially a historical artifact at this point.
Yeah.
I only bring it up because it perfectly illustrates how early researchers tried to forcefully map cultural stereotypes directly onto physical brain anatomy.
Well, good to know. We can throw that one out entirely. So what is the actual current theory regarding male and female brains?
What's fascinating here is that current theories argue the exact opposite of that old model.
Wait, really? The exact opposite?
Yeah. When modern researchers accept that gender differences exist at all, the prevailing view is that the female brain is thought to be more bilaterally organized,
Whoa, interesting.
meaning functions like language are shared more evenly across both the left and right hemispheres. Meanwhile, the male brain is thought to be more strictly lateralized.
So confined to one side.
Exactly. More rigidly confined to one specific hemisphere.
I mean, I still have to question this neat categorization. The brain is unfathomably complex.
Oh, absolutely.
Does the hard data actually support this clean division where female brains are bilateral and male brains are strictly lateralized? Or are we just, inventing a new stereotype?
Your skepticism is entirely justified, because the moment we look at the evidence, we enter an absolute methodological nightmare.
Uh-oh. Why is that?
One of the biggest historical issues here is publication bias.
Oh, the classic file drawer problem.
Exactly. Historically, a researcher would set up an experiment to test something completely unrelated to gender. They just throw equal numbers of men and women into the study to have a good sample size.
Right, just good scientific practice.
But if, by pure chance, they found a statistically significant difference between how the men and women performed, they published a paper on gender differences.
Oh, I see where this is going.
Yeah. But if they didn't find an effect, they didn't even mention gender in the final report. They just shoved it in a drawer.
Wow. So we end up with this highly skewed view of the science because we're only seeing the positive hits, not the mountain of no difference results that never saw the light of day.
Precisely. Now, to be fair, there is some clinical evidence that points to differences, but you have to understand how we gather that evidence.
Okay, let's hear it.
So, early clinical reviews, like McGlone's big review in 1980, looked at patients who had suffered localized brain lesions.
Like from strokes or tumors?
Right, strokes or tumors affecting just one hemisphere. And they measured these patients using the WAIS.
The Wechsler Adult Intelligence Scale, right?
Exactly. And the WAIS is broken down into verbal IQ and performance IQ. Verbal IQ tests things like vocabulary and comprehension, while performance IQ tests spatial manipulation.
Like arranging blocks into a pattern or something.
Yes, exactly. So they're looking at people with actual brain damage to see what functions get lost.
And what did McGlone find?
Well, she found that men showed a very specific rigid drop in their WAIS scores depending on where the brain damage was.
How specific?
If a man had a left hemisphere lesion, his verbal IQ plummeted. If he had a right hemisphere lesion, his performance IQ plummeted. It was very binary.
Wow. And the women?
Women with the exact same types of lesions did not show this strict division. Their scores dropped, but not in that highly localized, predictable way.
Which implies that the female brain was more bilateral. Like, if the left hemisphere was damaged, the right hemisphere already had some language processing capability.
Right, so it could compensate better. The function wasn't completely wiped out because it wasn't strictly localized to one side.
That makes a lot of sense.
And later clinical studies by Frith and Varga-Kadam in 2001 confirmed this. They found that women who suffered left hemisphere aphasia,
which is the loss of language ability due to brain damage, right?
Exactly. They found those women often had less severe aphasic effects and recovered faster than men with the identical injury.
Okay, so, that sounds like a slam dunk for the female brains are more bilateral theory. Why did you call it a methodological nightmare?
Because you have to contrast that clinical data, which comes from damaged brains, with experimental data from healthy, normal subjects.
Ah, the plot thickens.
Yeah. And researchers have run hundreds of experimental tests. For instance, they use something called a divided visual field task. Fairweather did a massive review of these in 1982.
Okay, let's break that down for the listener. How does a divided visual field task actually work?
It takes advantage of how our optic nerves are wired. If you stare straight ahead at a dot on a screen, anything that flashes briefly in your left peripheral vision is sent directly to your right brain hemisphere.
Okay.
And anything that flashes in your right peripheral vision goes to your left hemisphere.
So researchers flash words or images to one side for just a fraction of a second, and they measure which hemisphere processes the information faster or more accurately.
Exactly. It's a way to secretly interrogate one half of the brain without the other half interfering.
Brilliant. So what happens when they do this to healthy men and women?
Well, according to Fairweather's review, out of 111 major studies using this technique to test gender differences, 87 of them found absolutely zero effect of gender.
87 out of 111. That is a massive proportion of nothing to see here.
Right. No difference in how lateralized the processing was.
How do we reconcile the clinical data showing a difference with the experimental data showing no difference?
The debate raged for years until Hiscock and his colleagues did these massive meta-analyses between 1994 and 2001. They pooled the data from hundreds of different studies: auditory, visual, tactile.
And what was the verdict?
They finally brought some clarity. They found that there is a real statistical difference. Males do show slightly greater lateralization, but the effect is incredibly weak.
How weak are we talking? Give me the numbers.
At the population level, gender accounts for only 1 to 2% of the variance in brain lateralization.
1 to 2%. So it's basically a statistical whisper.
Exactly. Within gender variability completely swamps the between gender differences.
So meaning the difference in brain organization between two random women or two random men is vastly larger than the average difference between men and women as groups.
You've got it. You could never, ever use someone's gender to predict how their individual brain is organized in a clinical setting. It's totally useless for that.
Here's where it gets really interesting, though. If the differences are that tiny, it makes me wonder if we're even looking at the right metric.
What do you mean?
Well, maybe we shouldn't be looking at male versus female as binary categories, but rather at the underlying neurodevelopment, like the cocktail of hormones we're exposed to in the womb.
Oh, right.
Because that brings up a really fascinating link between lateralization and sexual orientation mentioned in the text.
Yes, if we connect this to early development, things get very interesting.
Yeah.
Lallemire conducted a major meta-analysis in 2000 that showed a significant link here.
Right, specifically regarding handedness.
Exactly. Lallemire found that individuals with a homosexual orientation have a significantly higher odds of being non-right-handed.
The numbers are wild. For men, the odds of being non-right-handed are about 34% greater, but for women, it's a staggering 91% greater odds compared to heterosexual women.
It is a massive statistical jump.
And because we know that handedness is a physical marker of how the brain is organized, this strongly points to the idea that both sexual orientation and brain lateralization are tied to the exact same deep developmental roots.
Precisely. We're talking about things like early prenatal factors or neurodevelopmental shifts that change how the brain's hemispheres organize themselves before birth.
It's just so fascinating.
It really is. It proves that lateralization isn't just some cultural artifact. It's deeply biological. But to close the loop on gender itself.
Right, the main takeaway.
While subtle differences in lateralization are real at a massive population level, they have almost no real-world clinical predictive value. If a surgeon needs to know where your language center is before operating, knowing your gender helps them 0%.
Okay, so if gender is practically negligible for predicting how an individual's brain is organized, we need to pivot to a better physical marker.
And that brings us to handedness.
Right. This is a trait that shows a much clearer, much more consistent relationship with cerebral asymmetry.
It's one of the most obvious ways human performance differs on a daily basis. But what is truly remarkable about left-handedness isn't just that it exists, but how mathematically consistent it is globally and historically.
Right. Across history and across almost all cultures, about 8 to 12% of the population is left-handed. It's a global constant.
It really is.
My absolute favorite anecdote from the chapter about this involves the Ipoh tribe in Papua New Guinea.
Oh, the earplug story.
Yes. Researchers wanted to know their handedness rates, but you can't exactly hand out a bunch of clipboard questionnaires in the middle of the rainforest.
Right, so what do they do?
Well, it turns out the Ipoh wear a decorative earplug on the ear opposite to the hand they use to shoot a bow and arrow.
That is so incredibly convenient for scientists.
I know. So researchers didn't need questionnaires. They just looked at photographs of the tribe, counted the earplugs, and boom. The ratio matched the 10% global average perfectly.
That intense mathematical consistency across completely disconnected cultures strongly implies a genetic foundation.
It has to, right?
Yeah, it's an evolutionary stability. If left-handedness was purely a disadvantage, it would have been bred out. If it was purely an advantage, well, it would be the majority. Instead, it hovers right around 10%.
So how do we explain that 10%?
To explain this, a researcher named Annett proposed the right shift theory. And the text notes this explains the data much better than older models, like the Levi-Nagelaki model.
Right. Let me try to translate this right shift theory for the listener, because the mechanism is brilliant.
Go for it.
Imagine your handedness is determined by a coin toss before you're born. Annett suggests that most of us inherit a genetic weighted coin from our parents.
Okay, a weighted coin.
Yeah, it's a single genetic factor that heavily, heavily biases the toss toward right-handedness and left hemisphere language. But if you don't happen to inherit that specific right shift genetic factor, your coin isn't weighted to the left.
Wait, so it's not a left-handed gene?
No! That's the genius of it. Your coin is just perfectly fair. It's 50-50.
That is a superb analogy. If you lack the right shift factor, chance alone dictates your handedness. Half of the people without the factor will randomly become right-handed, and half will become left-handed.
And this beautifully explains the genetics we see in families. It explains why two left-handed parents who presumably both like the right shift factor will have children who are left-handed about half the time rather than 100% of the time.
Right, because it's literally a fair coin toss for their kids.
Exactly.
And biologically, we're talking about inheriting either 2 copies of this gene, 1 copy, or 0 copies. If you have 0 copies, you're at the mercy of chance.
Okay, so now we know how people become lefties. The next logical step is to figure out what that means for the physical layout of their brains.
How does lacking this genetic shift change their functional brain mapping?
Well, historically, neuropsychology threw a bunch of different models at the wall to see what stuck.
They really did.
Let's walk through the 4 main theories, starting with the darkest one, pathological left-handedness.
Ah, yes. Bacon's theory.
Yeah. This was championed by a researcher named Bakken, who argued that left-handedness wasn't natural at all. He claimed it was the result of early brain trauma.
Specifically, something called perinatal anoxia, which is a lack of oxygen to the brain during a stressful birth.
Right. And the theory was that this lack of oxygen damaged the left hemisphere, forcing the right hemisphere to take over motor control of the dominant hand.
So basically saying all lefties are just brain-damaged righties.
Exactly. And I have to push back on this with just basic logic. If left-handedness was simply a side effect of severe oxygen deprivation and brain damage at birth, wouldn't we see a ton of other severe cognitive issues?
I think so, yes.
You wouldn't just be left-handed, you'd likely have major developmental delays or motor deficits. The idea that brain damage cleanly swaps your hand preference and does nothing else just doesn't add up.
Your logic is completely sound, and modern science agrees with you entirely. Researchers like Hicks and his colleagues later constructed tests specifically to replicate that birth stress theory.
And what did Hicks find?
They found that the relationship between birth risk factors and handedness is completely trivial. The pathological model really just reveals a historical, cultural bias against sinistrality.
Sinistrality being the clinical term for left-handedness.
Right, derived from the Latin word for left, which ironically is also the root of the word sinister. Society just had this old superstition that being left-handed was somehow damaged, evil, or wrong.
So we can confidently throw the brain damage theory in the trash. What was the second model?
The second model is much more common in popular culture today, the contralateral rule.
Contralateral just meaning opposite side.
Exactly. This model assumes a perfect mirror image. Since we know that right-handers process language in the left hemisphere, this rule assumes that left-handers must process language in the right hemisphere.
I mean, it's simple, it's clean, it makes intuitive sense, and it's probably entirely wrong, right?
Entirely wrong. And to prove why it's wrong, we have to look at one of the most fascinating clinical assessments in all of neurology, the WADA technique.
Oh, I love the WADA test. For you listening, imagine you're a patient about to undergo brain surgery, and the doctors need to map exactly where your language center is so they don't accidentally cut it out.
A very important precaution.
Very. So they have you lie down, keep your arms raised in the air, and start counting backward from 100. Then they inject a drug called sodium amytal directly into one of the carotid arteries in your neck.
Right. And because the blood supply to the brain is highly compartmentalized, that drug only goes to one hemisphere.
So it puts half the brain to sleep.
It essentially puts exactly one half of your brain to sleep for a few minutes.
It's wild. You're wide awake, but half your brain is unconscious. If they inject the left hemisphere, your right arm suddenly drops limp to the bed.
Yep. And if your language center is in that left hemisphere, you instantly stop counting. You physically cannot speak until the drug wears off.
It's the most definitive way to map the brain. So what happened when Rasmussen and Milner performed this test on left-handed patients?
It completely destroyed the mirror image theory. They found that a massive majority, about 70% of left-handers, still have their speech controlled by the left hemisphere.
Wow. Exactly like right-handers.
Exactly. Only about 15% of left-handers had pure right hemisphere speech. and the remaining 15% had speech represented bilaterally.
Meaning they could still talk somewhat regardless of which side was put to sleep.
Right. The function was shared.
So the vast majority of lefties are not mirror images at all. They're organized just like righties, at least when it comes to the primary location of speech.
And this isn't just one rogue study, by the way. Unilateral electroconvulsive therapy studies by Warrington and Pratt found the exact same thing.
Where they apply a shock to temporarily disable one hemisphere.
Yes. And aphasia studies by Satz backed it up too. Very few lefties have purely right hemisphere speech. Which brings us to the third and fourth models of the left-handed brain.
Right, bilateralization and the right shift model. Bilateralization basically states that left-handers just have a lesser degree of strict lateralization overall. Like, their functions are spread a bit more evenly across the two halves of the brain.
And then the right shift model just applies a nest genetic coin toss to the brain's layout, predicting that you'll see a mix of typical and atypical brain organizations depending on chance.
This raises an important question, though. What does the experimental evidence say?
Experimental evidence strongly backs this up. When we move from the surgical suite to the laboratory, we can test healthy subjects using a technique called dichotic listening.
Oh, dichotic listening. How does that one work?
It's like having two people shout different words at you at the exact same time. The researcher plays one word into your left ear and a completely different word into your right ear simultaneously.
Okay, sounds overwhelming.
It is. But because auditory pathways cross over, the right ear feeds directly to the left brain hemisphere, and the left ear feeds the right hemisphere.
So by seeing which word the subject registers first, or most accurately, we can hear which side of the brain is processing language faster.
It's basically a race between the hemispheres.
I love that. And in right-handers?
In right-handers, the right ear almost always wins because the left hemisphere is so dominant for language.
But in left-handers?
The results are much more mixed. The right ear advantage is significantly weaker or absent entirely.
Wow.
Yeah, this experimental evidence overwhelmingly proves that most left-handers have relatively bilateral, or at least less strongly lateralized, language processing. Therefore, the bilateralization and right shift models are the most accurate descriptions.
Okay, so lefties are more bilateral, but what does that actually mean for the cognitive mechanisms happening under the hood? Like, if a left-handed person is listening to a deep dive right now, how is their brain processing the information differently?
Well, there are a couple of models. Levy's model suggested that because language is bilateral, it crowds out spatial functions. But the leading models, like those from Beaumont and Hardick, suggest left-handers just have a more diffuse functional system overall.
Diffuse meaning spread out.
Yes. In a highly lateralized right-hander, the brain compartmentalizes tasks. Language stays on the left, spatial reasoning stays on the right. But in a left-hander, the brain relies much more heavily on interhemispheric communication.
So they're constantly passing information back and forth across the corpus callosum.
Exactly, that bridge between the two halves of the brain. They employ much more diffuse processing across both hemispheres simultaneously to solve complex tasks.
Okay, but if lefties are constantly passing information back and forth diffusely, how does that affect their real-world cognitive outcomes?
That was a big debate.
Right, because early on, there was a real scare in the academic community. Researchers like Levy and Miller published studies claiming that left-handers actually had lower WAIS performance intelligence scores.
They literally argued that lefties were fundamentally less capable.
Which is wild.
It caused quite a stir, but it was completely debunked by massive population studies.
Oh, thank goodness.
Yeah. Massive surveys, like the Oxfordshire survey involving tens of thousands of school children, found absolutely no overall intellectual deficit related to handedness.
So what was wrong with those early scary studies?
They were deeply flawed because they only looked at highly selected university students, which statistically skewed the performance data. Your overall intelligence is absolutely not dictated by your handedness.
But there are some nuanced cognitive differences, right? Like different cognitive styles. You see lefties clustering in certain professions?
Yes, we do see occupational clustering. For instance, studies have shown a statistically significant excess of left-handers among architects, lawyers, and artists.
Those are professions that perhaps benefit from that diffuse interhemispheric communication, like blending verbal logic with spatial creativity.
Precisely. Conversely, there is a distinct lack of left-handers among orthopedic surgeons and mathematicians, so it's simply a different cognitive style, not a deficit.
So what does this all mean? Knowing that lefties have this unique, diffuse brain organization is clearly crucial for clinical neuropsychology.
Oh, absolutely. If you're a doctor, you really want to know this before you start treating someone.
But the WADA test involves injecting drugs into the neck. It's highly invasive. Is there a simple physical shortcut a doctor can use in the exam room to figure out how a patient's brain is wired?
For a brief, exciting moment in the late 1970s, researchers thought they had found the ultimate shortcut. Levy and Reed published a theory based entirely on writing posture.
Writing posture, like how you hold a pen.
Yes. They categorized people as having either a normal writing posture where the pen points to the top of the page or an inverted posture.
The inverted posture is that classic lefty hook, right? Where the hand is curled all the way around and the pen points back down toward the bottom of the page.
Exactly. Levy and Reed claimed this hand posture was a direct window into the brain's wiring.
That seems almost too good to be true.
They promised that a normal posture meant your language was on the opposite side of your writing hand, and an inverted hooked posture meant your language was on the exact same side as your writing hand.
It was hailed as a revolutionary, wildly simple way to assess speech laterality in any individual without invasive tests. Like, all you had to do was ask them to write their name.
Right. It was the clinical assessment dream.
But let me guess, the human brain refused to be categorized that easily.
The data brought the hammer down hard. Subsequent studies entirely failed to support the model.
Ouch.
Yeah, the theory completely fell apart when researchers tried to replicate it using those auditory dichotic listening tasks we talked about.
So the shortcut was a dead end.
Totally. So to be definitively clear, writing posture is absolutely not a valid index for predicting cerebral lateralization in an individual. There are no easy shortcuts.
If we connect this to the bigger picture, distilling all these sources, gender differences in lateralization are practically negligible in real-world terms.
Right, 1 to 2% variance.
But handedness is a highly consistent indicator that a brain is likely more bilaterally organized.
Exactly. Which brings us to the end of Chapter 14.
And it brings me to a final thought I want you, the listener, to mull over. Think back to our opening idea of the universal anatomical blueprint.
The myth of the standard blueprint.
Right. If Annett's right shift theory is true, and the mere presence or absence of a single genetic factor can entirely reorganize how your brain's hemispheres process language, share information, and communicate.
And yet, whether you are right-handed or left-handed, your overall intelligence remains fundamentally exactly the same.
What does that suggest about the incredible built-in plasticity and redundancy of the human brain from the moment of conception?
It's a profound realization. We might not all have the exact same standard issue blueprint. The wiring might be crossed, the functions might be shared diffusely or compartmentalized strictly, but from the exact moment of conception, the machine finds a way to work flawlessly anyway.
It really is magnificent. Thank you for joining us on behalf of the Last Minute Lecture team. We hope this deep dive gave you a powerful shortcut to being well-informed on the magnificent, messy reality of the human brain. Keep questioning those textbook assumptions, and we will catch you next time.